the anatomy dissection we have completed. Now we are switching on to the next part of the human anatomy, that is the upper limb. As a rule, before going into the detail of the gross anatomy of the any part, we should be familiarized with the bones of that region. So we will first finish with the bones of the upper limb, then we will proceed further to explore the gross anatomy and applied anatomy related to the upper limb structures. So the limb is divided into three parts: brachium, the forearm is called the antebrachium, and hand is called manus. So these are the anatomical words we have to use, not the general word all the people are, non-medical people are using. So we are medical people. So arm is called brachium, antebrachium, and the hand is called the manus. So we will take the bones of the upper limb. The first and most important and beautiful bone of the human body is the clavicle. It is called the beauty bone or collar bone. Why beauty bone? Because in the female the curvature is more than the male, and it looks like a necklace in the anatomical necklace in the neck of the female, because the medial end is quite lower than the lateral end. So it is sinuously curved bone, and whenever the clavicle comes, 5 fingers and the 5 special features you should know about this bone, and the priority of the most important about the clavicle should be number 1, then 2, then 3 and 4 and 5. First most important part of the clavicle is, this is the only bone in the human body which start ossification first of all, plus last to complete also. So these words are the physics definition words. You have to remember, no change. It is the first bone to ossify in the human body and last to complete. Write down these words and underline it. It is not given in your book. Everything is going wrong in it. So now the question arises, when it starts ossification? The examiner will ask the second question to you. You have seen the viva, what we have done, what you have done. What is your level? So it starts ossification. What is ossification? Conversion of the soft bone into the hardest tissue of the bone, the body, that is the bone. So this change over the hardification or solidification of the bones are called the ossification. When a baby is born, all the bones are present in the human body, but they are soft. Why soft? Because they resemble the costal cartilage you have recently done, soft part of the thoracic cage. The best example of cartilage is your, so they are soft. All bones, they are soft. That's why you might have read the news and that a newborn baby or less than 1 year baby falls from the 10th floor alive, no fracture, because bones, they are flexible and they are soft and made up of cartilage. That's why. So these change over from the cartilage, that is the chondrocyte, to the bone, that is the osteocyte. This process is called ossification. So there is a chapter, full-fledged chapter of ossification already. I think you have finished with the general anatomy book, so you must be knowing. We will ask you what is the age of the ossification of a particular bone. How many years? At least you should know ossification of the long bones. particularly. So it is different in the male and female. That you have to remember. So question arises, when it starts ossification or solidification in the human life. So it starts ossification in the intrauterine life. Still the baby is only 4 to 5 weeks. Only 4 to 5 weeks. 1 month pregnancy. And the clavicle bones start solidifying. So that you have to remember. How many weeks?
4 to 5.
So this is the 4 to 5. And it is the bone which is last to complete. Means all the bones before it, they all become solid. This is the last bone which becomes solid. So it take a long process, a long duration to ossification. That you have to remember. And this should be told first of all whenever anybody asks you what you know about the 5 special features of the clavicle. First to ossify and last to complete, which is 21 to 24 years. A range. You can't say single 21 or 22. No, it's a range. It is a variable. If you say single word, 4 to 5 weeks, not 4 weeks, not 5 weeks. A range should be given. The second important thing about the clavicle, that it develops in the mesenchyme. It develops in the mesenchyme, or it is called the intramembranous ossification. Usually bones they develop in the from cartilage to the bone, chondrocyte to the osteoid, but it develops in the membrane, the mesenchyme, the mesodermal. All bones are mesodermal in origin, you know, mesodermal. So it is also mesodermal, but it develops in a paper or a sheet-like structure that is called the mesenchyme. So that you have to remember the second important thing. Third, it has no medullary cavity. It has no medullary cavity. Otherwise, you break any bone, it is hollow from inside, and there is a hollow space is there in any long bone. That is called the medullary canal, and this medullary canal is full of. So it is so it is a solid bone. No medullary cavity, no hollowness. That you have to remember, and this you have to utter on third. The fourth one, it is subcutaneous throughout its extent. What is subcutaneous? That if you touch it from medial end till lateral end, it lies just below your skin. You can touch it whole of the extent. No bone in the human body is having the subcutaneous position. All are either covered by the muscle or something else. But this is the only bone you can touch from the medial end, and you can feel it below your pulp of your finger tip till the lateral end. So it is called the subcutaneous. Sub means below, cutaneous means the skin. Another thing about this is, it is a long bone, but lying horizontally. So it is a long bone lying horizontally in the body. All the long bones, they are humerus, radius, ulna, femur, tibia, fibula. They are long bones. How they are lying? Vertically. It is the long bone. It is included in the long bones, but lying horizontally in the body. So that is your. So these are the 5 special features. There are so many other features are also, but these should be on your fingertips. 5 fingers, 5 features, the priority, the list one, the fix. So this is the clavicle. Now we will study the clavicle. So anybody you are holding, first we have to see what is the sex of the bone, whether it is a male bone or the female. Any bone you have to handle, whether the rib, first rib, second rib, third rib, sternum, vertebra. This should be your aptitude. Any bone you are handling, first feel it. What is the weight? And where you feel? Not on the palm, on the finger, because they are more sensitive than this. That is also the examiner will be observing where you are assessing the weight. If you are here, wrong, 0 number. This is you. Each and everything is observed by the examiner during Viva. You can't skip anything, you can't do anything wrong. Because this you must be knowing, and we expect that you should know it. So this is the weight. By seeing the volume of any bone, there is a rough estimation that it must be heavier or lighter. It is the common sense. We have not learnt about it. This comes by experience. So that is the weight, first of all. Then you close your eyes and feel the roughness of the bone. Any bone you have been handling. If it is rough to touch at the point where there are insertions, it means it is a male bone. So that you have to remember about this. So clavicle is described under 3 headings. Number 1 is the medial end. Then the shaft is the middle part, and third is the lateral end. This should be the sequence of studying as well as telling during the Viva also. You are not to start from the lateral to the medial. You are telling everything right, but your first description will be 0. It has to be from superior to inferior or from medial to lateral. That is the way how to describe any bone of the human body. So the first we have to see what is the medial end. So medial end of the clavicle is articulating with you have recently done with the lateral upper angle of the manubrium sterni. Manubrium. And medial end is strong, larger, and it is quadrilateral also. Quadrilateral in outline, and same reciprocally the articular facet on the upper lateral surface of the manubrium sterni is also quadrilateral. And it forms a joint. What you will name this joint? So you should know what are the names of the joints. Sternoclavicular joint. And these 2 sternoclavicular joints, they are very, very near to it. They are very, very near to them. And both the sternoclavicular joints, they are further connected, further strengthened, further becoming stronger by a interclavicular ligament. Interclavicular ligament makes the 2 sternal clavicular joints much more stronger and lifelong. That you should know, interclavicular ligament, and where this ligament passes? Through the sternal notch. And sternal notch is not straight, it is curved. So that's why it is called notch. Concavity. Interclavicular ligament lies just above the manubrium sterni, and it lies in a space that is called the suprasternal space of Burns. Suprasternal space of Burns. This is the upper and the sternal notch. This is the quadrilateral articular facet. So this joint is so formed is called the manubrio-clavicular joint or sternoclavicular joint. It's slightly movable synovial joint. The variety is a slightly movable synovial joint. And both the joints, they are interconnected by ligament that are called the interclavicular ligament. And this ligament is present in a space just above the sternal notch, where this ligament is suspended or present is called the suprasternal space of Burns. So Burns is the name of scientist who has discovered it. Suprasternal space of the Burns, interclavicular ligament. So medial end is quadrilateral and is very quite strong to be seen in outline and is bigger also. Then comes the next part is the shaft. The shaft of the clavicle is the middle part. And it is sinuously curved or convexity forward and the concavity posteriorly. In the female, it is more sinuously curved like this. So convexity in the female is much more than the male. This is the male bone, this is the female bone. And the shaft is having the four surfaces: superior, inferior, anterior and posterior. The borders, they are not well defined, but surfaces, they are well defined in the outline. That is the superior surface. As you know, superior surface is subcutaneous, just below the skin, and it is smooth. The anterior surface is rough. Why? Because it gives the attachment of a muscle. Then the inferior surface is also irregular. It is also rough because of the medially there is a muscle attachment and laterally there is a ligament attachment. That is, the inferior surface is rough because of the attachment of the muscles and the ligaments. The posterior surface is almost smooth and having no any special features. So that is how you describe the shaft of the clavicle bone. Sinuously curved is not horizontal. We say it is a horizontal bone, but it is not horizontal. It is curved anteriorly or convexity anteriorly, concavity posteriorly. And this is how to identify whether it belongs to the right side or left side. If you put on the left side, now the rough surface comes superior, which is not present, which is subcutaneous. Anything which is subcutaneous has to be smooth. So that is how you check the right and left side of the clavicle bone. See, the inferior surface is rough. In the medial part of the inferior surface, here lies a long groove, almost in the middle. There is a long shallow groove is there. This is called the subclavian groove. This is called the subclavian groove. And you already know what is subclavian groove, because you have done, this is for the insertion of the subclavius muscle. The first rib, you remember first rib. Because the manubrium sterni lateral upper end is also, there is another facet is lying posterior to the clavicular facet is for the costal cartilage of first rib. Not rib. Costal cartilage of the first rib. That you have to be very specific what you are saying. If you say rib, you are wrong. You get 0 marks. because bones are not touching the bone. There is a middle piece of costal cartilage. So costal cartilage of the first rib also lies posterior to the clavicular articulation. So this is a small piece of the costal cartilage of first rib, which is articulating to form the sternocostal joint. First rib costal cartilage with this term is called the sternocostal joint. Then this is the bony part of the first rib start. So the medial end of the first rib as well as the costal cartilage is hidden below the medial end of the clavicle, which is broad and quadrilateral. And a muscle is taking origin from the superior surface of the costal cartilage of the first rib and the adjoining part of the superior surface of the first rib. So somewhere here. And more on the costal cartilage is the origin of subclavius. Sub means below the clavicle. Clavius means clavicle. So this muscle lies below the clavicle, so we name it as the subclavius muscle. So this muscle goes below the clavicle, obliquely, anteriorly and laterally, because in the middle of the shaft of the inferior surface of the clavicle, a long groove is waiting, and this groove is named as the subclavian groove. So this muscle will be inserted on it. That is the feature of the inferior surface, and it is very helpful in identification of the side determination of the clavicle also. Subclavius muscle. So the first rib is also connected to the clavicle, or the clavicle is attached to the first rib. So it gives the more stronger medial end as well as the shaft. So this muscle gives the stability to the clavicle. Otherwise it doesn't have got any significant action. Only function of this is that from below the first rib it is coming and it is inserting below the clavicle. So it gives the outside support to the sternoclavicular joint, which is already very strong. Secondly, it has been made more strong by the interclavicular ligament. Third, this subclavius muscle is also stabilizing the sternoclavicular joint. So that is the function of this muscle. Then a lateral part of this clavicle, this is the posterior surface. So this is the anterior surface, this, the front. Now I am doing like this. So that is the what is seen on the posterior part. So subclavian groove just lateral to it and at the junction of medial 2/3 and lateral 1/3 of the clavicle, there lies a rough raised area. Again small potatoes, so they are called the tuber or tubercles. So two tubercles are present on the junction of the medial 2/3 and lateral 1/3 of the shaft of the clavicle. Which surface? Inferior surface, just lateral to the subclavian groove. And it has got two parts, medial part and lateral part. Medial and lateral part. As you have done in the first rib, any rib, so rib has got head, neck and tubercle. So tubercle was having two parts. Medial part, which is articular and smooth, and lateral part was rough and, so same is here, two tubercles are there, but both are rough. And both are named also. The medial one is called the conoid tubercle. Conoid tubercle, because it is conical in outline. Conoid tubercle. Cone-like. Softy you eat nowadays too much. So cone-like shape, that's why I call the conoid tubercle, and lateral to it, there is another tubercle raised area is there which is quadrilateral or somewhat resembling the mathematics again comes for medical people. It is trapezium or trapezium-like. 4, I think trapezium means 4 lines. So this is called the, because of the 4, it is called the trapezoid tubercle. Trapezoid, because it resembles the mathematics shape, trapezium, so it is called the trapezoid tubercle. Is lateral, you have to remember which is medial, which is lateral. Actually these two tubercles, they give the attachments to the same name ligaments, conoid ligament and trapezoid ligament, as the costo-transverse joint is also having the same name ligament, that is the costo-transverse. Same is here, these are the ligaments. Again, they are the fixation of the clavicle. Just at the junction of the medial 2/3 and the lateral 1/3 of the clavicle, below here lies a structure of the scapula just below it, which is like hook shape, comma shape. This is called Coracoid process. Again, words are coming which are, I have already told you, and not been nothing but this is the collection of 2000. So this is again a new word for you, Coracoid process. It's a Greek word, I don't know what is the name, meaning coracoid. You have to remember as such. Coracoid process of the scapula is a hook shape or question mark like bony projection. It lies just below the junction of the late 1/3 and medial 2/3 of the clavicle. So clavicle's inferior surface, because of the presence of the medial conoid tubercle and later trapezoid tubercle, the same name of the ligaments, they are coming from the clavicle and attaching to the coracoid process. And one ligament is softy cone-like, so it is called the conoid tubercle. And another ligament is trapezoid type, so it is called the trapezoid ligament. So again, they give the fixity to the clavicle. So clavicle is also attached to the scapula anteriorly with the coracoid process. So this is fixed, this is fixed, this is fixed. So this will give the fixity to the clavicle. So it is a non-weight transmitting bone, and it only keeps the arm away from the human body in all positions of the functional or the working of the upper limb. So that is important. Otherwise, if this clavicle is not present, it will come like this, and all the movements of the upper limb will be disturbed. So it keeps the arm or upper extremity away from the body. That is why it is lying horizontally. So its medial 2/3 is very much fixed by two ligaments, one muscle, and one more ligament and the joint. So that is the fixity of the medial 2/3 of the what is called the clavicle. Now comes the lateral 1/3. Lateral 1/3 of the clavicle is special. Why it is special? Because number one, it is concave anteriorly and convex posteriorly, that is opposite to the medial 2/3. Number one. Number two, it is dorso-ventrally compressed, flattened, while the clavicle is almost triangular or quadrilateral. So number two, you have to write flattened. It has got superior surface, inferior surface, anterior border and posterior border, and one is lateral border. So description is different from the clavicle medial 2/3. And The lateral surface of the lateral end is having a oval articular facet. Oval articular facet anteriorly. Somewhere here. And this articular facet will form a joint with the acromion of the scapula. Again a new word, write down. Acromion. Acromion process of the scapula, spine. So it articulates with it. So is also fixed to the scapula. The lateral end of the clavicle is fixed. So it forms the acromioclavicular joint. The name of the joint, underline, acromioclavicular joint. Acromioclavicular joint. So it is, clavicle is fixed also laterally by this joint. Again a slightly movable joint. So that is how we describe the clavicle, the morphology, that is the surfaces and the borders. Now comes its what is called the attachments. The muscle attachments, one we have already done, the insertion of the subclavius. Then pectoralis major muscle. So this is the origin of the pectoralis from the anterior surface. From the anterior surface of the clavicle. But how much, that is important. That is the medial half. So medial half of the shaft of the clavicle gives the origin of the pectoralis major muscle. Your book has given wrongly. Your book is saying it is the medial 2/3. Correct it. And same is saying in the Viva, and people are getting 0 marks who has not attended classes. So that is the difference. Your last class has got, out of 250, 70 plus compartments in anatomy. 70. This is up to you. You may increase this number or decrease. So these small things, they value too much. And you will see now the result of the thorax viva. You will came to know where you are standing. So medial half of the shaft of the clavicle gives the origin of the pectoralis major, and lateral 1/3 of the anterior surface of the clavicle give the origin of deltoid muscle. Lateral 1/3, not medial 2/3. If the medial 2/3 is there, then the pectoralis major might have come and meet with the deltoid. But there is a gap here. And this gap is very important gap. Who will write medial 2/3 of the origin pectoralis major get 0 marks. Because if he says, it means the muscle has come up to here. Then a very important thing has occurring in this area. How it is possible when the muscle fuse with the muscle. So that we'll do later on, why there is a gap. And this gap is very essential. That's why origin of the pectoralis major is only medial half of the clavicle. Underline half. Then the posterior border of the clavicle in the lateral 1/3, it gives the insertion of a muscle. Posterior border, that is the trapezius. Trapezius muscle, again mathematics, trapezius muscle will go in later on in the head and neck region. At most we know the name of the muscle. Trapezius from the lateral 1/3 of the posterior border of the clavicle. Lateral 1/3. And posterior border, medial 1/3. Another muscle taking origin is the sternocleidomastoid. The name of the muscle is sternocleido, means clavicle, mastoid is again the process. Sternocleidomastoid is the name of the muscle attached. So that is the muscle attachment to the clavicle. Then comes the applied anatomy of the clavicle. So fracture of the clavicle is a silent fracture. All the other fractures in the human body, they are very, very painful. And whenever there is a fracture, the patient immediately came to know that I got fracture. But clavicle is the bone where the fracture is unnoticed by the patient. And fracture is very, very common at one point here. This is the junction of medial 2/3 and lateral 1/3. So fracture of the clavicle is common at the junction of the medial 2/3 and lateral 1/3. The question will be asked next, why? As you have done in the rib, where the fracture of the rib is common, near the, and what was the next answer? Because it was already curved. Same is here. Medial 2/3 convex forward and lateral 1/3 is convex posterior. So again it is a curved bone. Sinuously curved. So sudden change in the curvature is the weak point of any bone. Like first rib, so clavicle bone is very much fractured at the junction of the lateral 1/3 and medial 2/3. You have to remember about the fracture. Why it is silent? Because it is a long bone lying horizontally, and it is a non-weight transmitting bone. If the weight has been transmitted through it, you might have experienced the pain. And how see the fixation of the clavicle is so beautifully. Medial end, middle part, and again middle part, and again lateral part, they are all fixed. So where there is a chance of displacement. So dislocation of clavicle is minimal. And this is the reason why it is non-painful fracture of the human bone. Anybody asks you, any bone of the human body having no pain, even after fracture, the answer is clavicle. And then you have to answer why. Because of fixity. How strongly it is fixed by the muscles and the ligaments to the neighboring bones, the sternum, Coracoid process of the scapula, acromion of the scapula, first rib. They are the surrounding ribs around the clavicle which gives the fixity. Doctor fix it. So this is doctor fix it. But one condition is there when the clavicle bone is having the painful fracture. Noticed immediately, at once. Otherwise, how the people came to know that you got fracture? That is only in the morning when they are taking bath. When they are putting their soap here, what they feel? Oh, there is some swelling is there. So your hand or your thumb or finger will feel that some problem is there at the junction of medial 2/3 and lateral 1/3. Because lateral 1/3 is already normally it is a flat. Then what is this swelling? Not visible. Then you go for X-ray, and the X-ray will show there is a fracture. But there is a condition. Head and neck we will do. Again, the posterior part, this is having nothing here, and is very important because this area is for the entry of something. What enters here? A neck nerve comes. The name of this nerve from the neck is called the supraclavicular nerve. Supra means superior, clavicle means clavicle. Root value is C3 and C4. And this supraclavicular nerve, before entering into the upper part of the thorax, before it passing above the clavicle, just below the skin, it divides into 3 branches: medial branch, lateral branch, and intermediate branch. And what is the function of this nerve? It is cutaneous, so it is sensory, so it supplies the skin of the upper part of the thorax. You might have done in the thorax, the cutaneous nerve supply of the thorax, the chest wall. So whatever the length of the clavicle, see, it almost covers the medial end sternum and laterally the thorax. So upper part of the thoracic cavity, the skin covering is supplied by 3 branches: medial, intermediate, and supraclavicular, that is the C3 and C4 root value. So root value is again very important. In examiner, every in viva will ask you root value of any nerve you are studying. In theory also. So these 3 nerves, they pass above the clavicle, below the skin, and they supply their respective area, the upper part of this much of the chest skin. But the intermediate branch is special. In some individuals, this nerve passes through the bone. And which part of the bone? At the junction of medial 2/3 and lateral 1/3, where the fracture is most common. So in some individuals, instead of passing above the clavicle, it passes through the bone. That is called intraosseous course. But you will write down the word intraosseous. Bone. Osseous means bone. So it passes through the bone, intraosseous bone, and we know fracture is very, very common here. So whenever the fracture will be there, what will happen? The nerve will be pressed or maybe injured or crushed between the 2 fractured fragments. And that becomes painful. So in those individuals who are having the intraosseous course of the intermediate branch, write down intermediate branch only, of the supraclavicular nerve, they will at once or immediately came to know the fracture of the clavicle. So that is the applied importance of the fracture. So that will be painful. And it is well noticed. Supraclavicular intermediate branch. So this is how we do the first bone of the upper limb, that is the clavicle. This is the most important. Other bones, they are not much important and much extensive, but this has to be small bone, but is very, very important in the practical as well in the theory.